Hello everyone, and welcome to our April workshop. My name is Sherilyn Palston. I am a staff member here at the Center and Outreach Coordinator for BioTouch. Tonight you're going to learn the points in addressing cataracts and glaucoma in the care and symptoms of. And on a personal note, I myself am dealing with cataracts and will be having them removed this summer. And of course, I will definitely be having lots of BioTouch before and after the procedure. This is an excellent example of how BioTouch is an integral part with other healing modalities and very effective. BioTouch is a powerful tool to have at your fingertips for all aspects of your healing journey. So at this point, I'm going to introduce our speaker, Les Geisel. He is one of our recipients and has dealt with these issues himself. Les?
Woohoo!
Yeah.
Woohoo!
Actually, I'm not going to stand and speak. I think I'll just sit at eye level and we'll talk. I've been a recipient here since 2008. And of course, worked through several issues, among them eyes. But it has eliminated over the years 2 invasive procedures, medical procedures, and eliminated several issues of pain. So that's my overall experience with BioTouch. And with the eyes, those little peepers, I'll tell you in the morning, it's time to get those cells moving. I've had a couple of issues there. Cataracts and glaucoma are 2 eye conditions, but there's, of course, another one called macular degeneration, right? And little things like dry eyes and so on. But you know, the one thing about the eyes, they don't complain, do they? They don't tell you something's wrong. Not like your spine or your elbow or your muscles. They don't say a word. So everything is sort of creeps up. And the first, of course, is vision. Near, all of a sudden the words aren't so clear. So little by little, your optometrist says, no, I think I'll write a prescription for you. And then little by little, as you age, and most of these things, as Mike will tell you, glaucoma is not age-related necessarily. But most of them come about from getting a little bit older. So as you get a little bit older, Sherilyn, right, about cataracts, right? Mm-hmm. All of a sudden, those headlights coming down the road are awfully bright. You can't look at them anymore. So your optometrist will tell you to go to, well, his optician. And the optician says, yeah, you got a little cataract situation there. So eventually it'll lead to some surgery. But the eyes aren't complaining. There's no pain. There's nothing there. Glaucoma, right? It's an ocular pressure. And you don't know what's coming. You don't know what's there. All of a sudden, this same optician takes a look at your ocular pressure and says, wait a minute, that's a little high. And so, on it goes, and it increases, doesn't it? It increases. But the eye doesn't complain. So these things you don't know about. It's not like other areas in the BioTouch experience where you have pain, soreness, those types of things. So the eye's a little different. With, I'm going to drop back a second. One thing that came up that I wasn't aware of, and there's some subtleties with BioTouch. Is anybody else here a recipient? you are. Yeah.
Biotouch?
Yeah. Okay. There's subtleties involved with biotouch that you really don't recognize. And so research papers that I haven't, this is the first time I really picked them up, that are here, they're right here. One by Dr. Kenneth Stevenson and Gary Swartz. One of the things they found was that biotouch will increase the interleukin-12. Now, interleukin-12 is something you can't get a shot for, you can't take a pill, your body generates it. Sole thing, it doesn't come from any place else. It's one of the main factors in getting your little T cells moving. So it improves your immune system. But what they found in 1990 somewhere, 95, 96, was that it also is an anti-inflammatory. So, and when you sort of look into glaucoma with cataracts, and well, I don't know much about macular degeneration. There's a wet and a dry. There could be some inflammation there. But so, increasing the interleukin-12, I feel, because one of my experiences was, as Bev will tell you, I came whining in here one day and complained with the fact that the optician had told me my glaucoma reading was a little high. A little high. So I whined to Bev, and she started working on this eye. Excuse me, it was this eye. And the next, I had to come back in 6 months, so the next 6 months I went back and it was still about the same. But then, the next 6 months, it was normal. Now, he wanted me to come back every 6 months to check that. The last visit to the optician, he says, I don't want to see you for a year. So, and the only thing I know was biotouch. The only thing I know that we were doing. And as an aside, Ben was telling me a couple of weeks ago, do you know something? This eye is wider than your eye, the one we've been working on. So now we're doing research once a week. We're checking to see if the other eye will widen out. So somewhere along the line, excuse me, Mike, it's given me some relief. I'm sure it's biotouch. I can't think of anything else that has relieved that pressure. Now, I'm probably drawing a wide conclusion, but the fact of the matter is that I believe inflammation had a part of it, and I believe the interleukin-12 issue, along with stress and some of the other care issues that come from the touch, improved that. Now, as I say, macular degeneration, I don't know much about it. Cataracts, I'm not too sure about, except that has to do, well, glaucoma, first of all, let me go back. Two things happen. One is there's a little mesh behind your retina, back in the back of your eye. And of course, there's lots of blood vessels coming to your eye. So, either one of two things is happening or both. One is that little mesh back there gets clogged up. And so the fluid, the ocular fluid, can't flow normally. And so it builds up pressure. And the same with the blood vessels. So there again, I'm drawing a conclusion, unscientific of course, that inflammation is involved. Along with the caring touch, I am just convinced that that's what has done that for me. And with cataracts, there's actually a blood vessel issue too that goes on. They get blocked, and it forms the blood vessels in your eye form like they clot a little bit, and so that's the cataract. Now, I was going to say macular degeneration, I don't know. That's too far beyond me. But anyway, that's my conclusion, that inflammation is part of the problem, and that the relief of that inflammation comes from biotouch. Any questions? Has everybody seen these papers that are in here?
No.
There's several, and one does a little bit. This one from Kenneth Stevenson, right? And it's really it's a study. It's a good study. And the other subtleties, of course, are the lower blood pressure. Back me up on that. What was that study? Did I hear 500 folks were measured for their blood pressure? Did I hear that number correctly?
Yeah, at least that many.
Yeah, and it was it 100% or close to 100% reduced blood pressure?
Oh, I don't know the percentage, but
was
significant drop
Right,
in
right.
everybody.
So there you are, blood pressure. Those are the little subtleties. You get to know your body better over the years. You pay attention to little things that are going on to your body. So, any questions? I don't have a lot of clinical answers, but if there's any questions about my experience here, or
Well, my major difficulty is with the age-related macular degeneration, which I was hoping was going to be covered tonight.
wet or dry?
He didn't say.
How long ago?
3 weeks, 4 weeks.
Oh, okay. I'd ask him that,
Okay.
wet or dry. That's important. You're going to a retinologist?
Yes,
Yeah.
but they say they can't. He said he put me on something called preserve vision,
Okay.
Presser vision, I guess.
Presser
And he wants to see me in 6 months.
Mm-hmm.
So,
You know,
but I've had cataract surgery, and I had retinal surgery for a pucker.
oh really?
10 years or so ago. But he says something has developed along the surgical stitching on my right eye. But I'm
Excuse me, is this in one eye your problem?
both of them.
Okay. Yeah,
One is just worse than the other.
okay. I'll tell you, it wouldn't hurt. It wouldn't hurt to have biotouch on those eyes, especially. And when she started focusing on this eye, and I mean really focusing, and they'll show you some of the touches and the sweeps. It changed. It changed. Oh, there is that one little thing. I have a thing going on that's not in the eye, but it's called lower eyebrow entropion. Your eyebrow, sort of your lower eye, sort of closes in, and so you have these little eyebrow or eyelashes stroking your eye. And that was one of the invasive procedures. So they wanted to do plastic surgery on it and get it all straightened out. Well, lo and behold, I canceled that surgery because the eyelashes aren't in there. And basically it was just working on the eye. There's some sweeps. It was fantastic. So it wouldn't hurt to tell you, but just give it a try. Let's see, on a regular basis would be good. Anyway.
Okay, perfect. Thanks, Les.
Thank you.
So, hello everyone. My name is Bev. Oh, no, I'm Paul.
I'm Deb.
And this is, for those who don't know, this is the reversal of the Mondays with Bev and Paul. So we have a Monday show where we call it Mondays with Bev and Paul. but she sits on this side and I sit on that side. So these are the health condition workshops with Paul and Bev. So
There you go.
I get the top billing.
You've got to get top billing.
Thank you, Les.
Thank you,
Yeah,
Lester.
my
That
pleasure.
was
My
wonderful.
pleasure.
Thanks for sharing that.
It's always nice to hear the research that our presenters bring about a particular condition. Because I've just been working on people for 30 years and I don't really know how people get the problems that they have. It's just nice to know that we have something we can do and we don't necessarily have to know how you get it. And actually, I just got an email from that guy in France.
Oh, right.
So we asked this guy in France, how did you hear about us? And he was searching the web. And he's been involved in a lot of healing techniques. And what he liked about BioTouch's presentation was A, we didn't claim anything. We didn't claim quantum this or quantum that or energetically this or energetically that. He watched one of the interviews that was done with me. And when somebody asked me, well, how does it work? And I said, I don't know. He loved that. And this guy knows a lot of stuff too. And then he just couldn't believe how reasonably priced it was, actually cheap, in order to learn the technique. So he became a member and now he's got the ebook version.
Perfect.
And I told him to keep us in touch about, how he perceived it, And at the same time we heard from him, we heard from somebody in Malaysia. So all this happened in the past 2 days. So you're all here on a global level. And
Yes.
are there any other reasons people are here? So we have macular degeneration, any other particular glaucoma?
Right.
Yeah.
Cataracts.
And-
Cataracts here.
Cataracts?
Yeah, we
Both of you?
have been- Yeah, we both have been told we have them.
Okay.
But his right eye, he can't see, he's blind in the right eye.
Okay.
You want help that?
Are you totally one?
Pretty much, yeah.
Well, pretty much is not total. So,
Yeah.
so you've still got all the nerves and stuff?
Yeah, the lens is gone, the retina is completely detached.
Detached retina. So I would suggest you read the book.
Yeah,
Right.
you bet.
Because in the book is, and the book that we're talking about is, you're not going to get my life history here tonight. If you come to our full class, we have more time for that. But my life on how I met Norman, the man who made up the system, and my life as a hippie, and meeting this big burly guy in the backwoods of Colorado, and how we started the public awareness of BioTouch. And it's been 30 years since I've been doing this. And we're just moving into our next 30 years. And one of the testimonials in there is about a man who was blind. He had pigmentosa retinosa, I think it's called. And after a few months of working with him, as he expresses it, one day he was shaving and he saw the most ugliest thing in the mirror. And it was him. And so anything is possible. That's our biblical story. The other story we have is I can walk on water.
As long as the shallow puddle.
Right.
We're teaching Bev. She actually flies.
Yeah.
Yeah,
I levitate.
I want to say something. I'm legally blind and I've been reading that book. And it's really very emotional to me as far as how far you've gone with a particular procedure. Unbelievable.
Thanks.
And I just hope that, I think it's helping me a little bit. I can't tell because I'm blind in the left eye and have probably 5 to 7% left in the right eye. But I can still see something, and that is amazing according to the doctors at the Blind Center at the VA hospital.
Wow.
I've had it for 52 years.
Wow. It's amazing, huh?
The one thing we're not going to do is claim anything.
Right.
And the other thing that we know is, it can't hurt to let yourself be loved. If that's all we're doing here, then the interleukin 12s, the blood pressures, people's reversal of diseases and symptoms, that's just the icing on the cake. But if just these two fingers reaching out and touching someone is about an expression of loving one another and letting ourselves be loved, the body has to follow. That talks about that all the time.
Yeah. Well, you know, for me, it's really magical. We're magical. That's why. We, you know, we don't make any pretenses that we know what's going on. But what we do know is that the body is the power in our lives. And BioTouch specifically addresses the body. And what happens with that light, loving touch, it just begins a process of remembering that we are already empowered. And whatever we're going through is what we're going through. But BioTouch is here to give us some hope. We don't know what's going to happen on that journey, but we do know that whatever unfolds from this amazing technique it is magical for all of us. So, you know, when we start talking about, you know, oh, it happens because of this, or maybe I'm not doing this right, what happens with that is we just get in the way, because the body is already innately able to heal. I mean, it's really what it wants. It wants to be whole and healthy and in balance. BioTouch is here to help that process. So all of us who are really blessed to find this, whatever capacity is, whether you become a practitioner or a recipient, I'll just say our purpose right now is for you to learn this technique tonight, and for you to be able to help each other all the time, anytime, in your home. You don't have to go to anybody, make an appointment. It's always going to be there for you. You're going to get this little workbook. It's going to show you the points. We're going to help you tonight. You're going to practice. And you're going to tonight, after tonight, be able to go home. And you're going to be able to do the eye set with her, and she's going to be able to do the eye set with you and start the healing process. You're not going to be helpless in this journey. You're going to be, it's a relationship.
I was just going to add for Bev, and I think most importantly for all of life, if you don't take the journey, you will never know.
Thank you.
And you're all here, obviously, to take the journey.
That's right.
So we're going to give the workbook and we'll go over this. Let's see, did you guys come together here? There's yours. And you guys came together, Jim?
Yeah.
You guys came together. So what we've done in these classes, when we were first publishing the book, we had interviews with different people. And this one guy in New York got our manual in DVD, and he said, you know, you say this is a simple technique, but I open up this book and there's 17 sets of points, and there's a DVD, and there's lots of words. He says, I don't think that's very simple. And all of a sudden we went, oh my God, you're right. You know, for most people, such as tonight, you have an eye issue. You want to work on your eyes. And so you don't need to know how to work on the lungs. You don't need to know how to do a lot of other things in here. And so what we created were these health condition workshops, where this little piece of paper you got here is what we call our health condition workbook. And what we do is on the front, we talk about the disease or the problem itself, you know, based on clinical research that we found online. We have a speaker come talk about it that they research a little about. And then what we do is we pull out the key sets of points that you will need to address that particular symptom or disease. And as you can see tonight, we're only going to have to do 3 sets of points to address all these conditions we just heard about. Now that's simple. Okay? That's simple. That's doable. Yeah. You're talking, you know, 5 minutes worth of work, and even if that's 5 minutes 2 to 3 times a week, it's not like even 3 times a day, or like my wife who has to take this pain medication, we have to write it down, because this one has to be every 6 hours, this one has to be every 8 hours, you know, and if the pain starts to come back, then you got to do it again. BioTouch is about consistency too, but it's not about having to keep track. So a few times a week, if you can do it every day, great. If you do it while you're watching TV, if you do it before you're going to bed, if you do it when you're in the shower, it doesn't matter. You know, if you both shower together, that is. Yes, you do.
The innocent look, right?
You might need the ear set.
Yeah.
The hippie is revealed.
Yeah, right.
Yeah, there you go.
There's that hippie.
There you go.
So, that's what we do with this. And so these classes are designed to only be 2 hours, so that we just give you the basics. But you know, any questions that you have as we go along, and we don't go into a lot of the history. We don't go into a lot of the song and dance about, you know, other things. If you want a lot of more detail, then we do have classes that we'll talk a little about later. But any questions so far? Otherwise, we're going to let Bev start taking us through this manual, and then we're going to bring up our dummy. I'm already here.
I'm sorry, you left that one open for me. You should know by now. So let's all turn to, in our workbook, page 6. It's what is BioTouch? So we're just going to go briefly over so you have a basic understanding. What is BioTouch? Well, it is a very light touch healing modality using the first 2 fingers of your hands and very lightly touching someone on the skin. So just somebody sitting next to you, just reach over and touch them like a butterfly, just on their arm. So you just get an idea of how very light. The lighter the touch, the body really responds because it's so non-invasive and it's just very powerful. So very light touch. We hold each point, as we'll go into a little bit more in detail, 6 to 8 seconds. That seems to be the key. So you're holding 6 to 8 seconds. And there's, as Paul said, there's specific sets of points that address every disease and condition that can be identified by medical science. It's amazing. And we're area specific, not symptoms. So for anything, as you're going to find tonight, as for anything having to do with the eyes, you're going to do just the eye set. It's going to take up whatever's going on. If you have any type of respiratory issue, COPD, emphysema, lung disease, whatever, the lung set, it will take care of everything under that description. So we don't need to really know the anatomy of the body. Where's the pain? Where's the issue? BioTouch just takes you right to where it needs to be. That's simple. That's the body saying, touch me here. I need it there, and the body knows what to do with that touch. So we always wash our hands before we begin to work with somebody. Always these first 2 fingers and holding every point 6 to 8 seconds. That's it, right? That's it. So let's just go over a couple of these bullets. Yeah, BioTouch is easy to learn. Even children have learned, have become certified practitioners. I don't know, I always think, well, they're the child in all of us. It's so simple and so loving that I think when it starts addressing maybe the child within us, because children already know the power of BioTouch. They've already figured it out. And so when we have the opportunity to do BioTouch with another person, it's a true relationship, because both of you will give and receive. It's not just about you giving and you receiving. It's about you giving and receiving and you giving and receiving. It's amazing. So you're in the presence of another person, and it's very intimate, and it's very safe, and it's very loving. And the body in that environment just begins to do what it knows how to do. And that's to come into a wholesomeness, a balancing. So it's very, easy for us to learn just how to touch. Very, very basic sets of points. So so for us, we don't consider BioTouch an alternative modality. it's a complementary, or as we're beginning to really see, integrative. So we have a lot of massage therapists that take this class, most of them start using it in their own practice, and it's an amazing fit. But you can use BioTouch in conjunction with, integrated with everything. The wonderful thing about it, and we always encourage everyone to always work with their traditional allopathic doctor if you're under a doctor's care. But BioTouch of itself will definitely bring some changes, so that's why we always encourage, if something changes in your own awareness about what's going on in your body, we really encourage you to, seek out that kind of aid and guidance. So,
but it's also important to work with your healthcare practitioner, because they might be getting ready, as Les said, to do an operation, or they might have you on medications for a particular condition. And it's important for them to know what else you're doing, because if you improve, they need to know that you've been doing something else. Otherwise, sometimes what happens is they keep you on that same dose of medication, you're improving, and now all of a sudden you're overdosing on medication because they don't understand that your body could be getting better. So you actually become an advocate for integrative care with a lot of doctors too, and speaking up about things that you're doing and helping to educate your medical professional too. So,
is there hesitancy for a medical person to lower the doses of a drug, for example, because, oh, I'm doing BioTouch? They're like, oh, well, yeah, that makes sense. Let's drop your dosage. I think you'd feel a lot of resistance from those people.
Because they usually don't get it.
Yeah.
But more and more they're opening up. I mean, we work with the School of Integrative Medicine, a lot of these young doctors coming up, and it's amazing. They'll come from all over the world, and they're integrating these different energy modalities, homeopathy, herbal remedies into their practices now. As we have one student here who says, BioTouch is just going to help him be a better doctor. He might not necessarily practice it, but at least he's knowing about it, and he can send his patients to get it, to have them be able to learn it. So it is more and more. We still need a lot of work to do, maybe in the next 30 years. But yeah, but it's up to the patient to educate their doctor. It's time for us to have our voice in our own healthcare, and
take responsibility.
Yeah,
for sure. And a lot of people are beginning to get that. I think, all you got to do is just look out there and see all these alternative and complementary different healing techniques that are out there. Something's going on. So, we're all stepping up there a little bit. So BioTouch, it's time for BioTouch to take its place. With a new kid on the block, basically. And not a lot of people, when you think about Reiki, everybody knows somebody who's a Reiki master. But, you're like, BioTouch? What? So, we're there. So the next bullet is, so no levels of ability. So what you're going to find out tonight is when you practice these sets of points that address glaucoma, cataracts, and any eye condition, immediately you will have that technique and you will be effective. There's no levels, no mastery of anything. You don't have to spend loads of money or go through all of these initiatory processes to be a BioTouch practitioner. It happens immediately. And I really don't know of any other modality that can claim that. So we claim that we are the most unique healing technique. And now we're setting out on a new course to actually back that up. And it's true. Even the people who are helping us, this branding says, I totally agree with you. I've done all this research, nobody is like you. We are very unique because it belongs to each of us. It's not just a certain class of people that can afford to go through something or has the ability to learn something or has the time. BioTouch is accessible on every single level in our lives, and it's already inherent within us to know how to use it. Our bodies already know what to do with it, and so we're just trying to connect you with what's already yours. And this is why this foundation is a nonprofit. We offer sessions here on a donation basis because we truly believe that your birthright is to be healthy and happy. How can we don't charge you for something that's already yours. And we're really true to that gift. We're going to be here holding that for people all over the world, because healing and happiness have nothing to do with what you can afford and what you cannot afford. So you will be effective the very first time you touch another person with BioTouch, no doubt. And the lovely thing is, you don't have to have a philosophy. We don't have a philosophy, except it's a philosophy of we don't know. People ask us, well, don't you think it's this? Don't you think it's that? It could be. What BioTouch does, not just in our language, but in that relationship, it opens up this space of neutrality for the couple, the two people involved. There doesn't have to be, well, don't you think it's this, and don't you think it's that, maybe it's this, and maybe. All things are okay. Everybody's right. If somebody says, well, I think BioTouch is this and this and this, fine. That's what BioTouch itself is. It's just this neutralized space of love and caring for another human being. That's the only qualification that you need to have to do BioTouch, is to just have some compassion and want to help somebody in their pain and stress. That's it. And you've got it. You've got the magic.
So that's any questions about BioTouch or what I ate for dinner? What I'm going to have for a drink after the class?
What are we going to have?
So we're going to start teaching some of the points. If you'll notice over here, terms used in the manual, we're not going to go over those. Those are different terms that are a matter of convenience as we teach the whole technique. But you don't need to know whether you're cross-firing or through-firing. Or you'll notice there that an associate is a key. That's the person who's receiving the technique in the manual. We call them recipients or associates. And what's nice about it is, as it says there, a person who performs the procedures in this manual, yeah, it's not the recipient, it's the person doing it.
I didn't say that.
Ding!
In 30 years, you'll have it.
Yeah.
Brain cells are dying.
I'm at the phase of my life where I need to start forgetting things. They call it dementia, but I call it enlightenment. So.
I like yours better.
Where was it? Oh yeah, one often in company with another implying intimacy or equality, and one having an interest in common with another. And we really like that, because that's what we feel when we're working with people. Everybody's equal. We're all the same. We're all, as I say to the teenagers, we're all bozos on the boat. We just have a different boat. We're going to a different shore, but we're on planet Earth, and that's just what's fun about this technique. And then other sets of points here you'll start learning as we do that, other terms and things like that. So it's not necessary to understand those in order to practice the 3 sets of points we're going to do. So what we're going to do is we're going to bring our little dummy. This dummy is going to go over there. And we'll bring that dummy up in front, and we're going to show you these 3 sets of points, and we're going to practice.
And you'll have it. Let's see if she'll comply with us tonight. Yikes. This might be one of the things we improve on over there. I'm not sure. Okay, so let's go to the first page of the actual, called the greeting. That's on page 8.
Can you go on to see this video on here that it says click here to watch the video? Is that
that's actually on the when you download the ebook,
No, the workbook too.
the workbook?
Oh,
Yeah,
we'll
you-
tell you
when
later.
you
We'll
go-
tell you
yeah,
later.
We'll tell you about, he'll tell you about that. Okay. So we're gonna learn the greeting. This is the key to everything you'll ever do with BioTouch. It is something that you will do every single time when you work with somebody else. Even if you're gonna do one set, you always wanna do the greeting first. So it's very simple. So we've washed our hands. We're going to locate what we call a hold point, which is you're going to take 2 fingers and you're going to rest that right in that soft tissue just below the breastbone or the sternum. You're going to rest your 2 fingers there very lightly. You're going to hold there. Actually, let me back up. This is the only set you're going to use one hand, and you're going to use your dominant hand. So I'm right-handed, so I'm going to use my right hand, and I'm going to rest it very lightly on that soft tissue. I'm going to hold it 6 to 8 seconds. So that's point 1. Point 2 is on the back. In the book, there's this little diamond up. You see the diamond? We call that the big bone. It's right at the base of the neck. It's this big bone that pops out. For point 2, we want to be to the left about 1 to 1.5 inches, directly in line with the big bone. And again, very lightly touch on the skin, holding 6 to 8 seconds. That is the greeting. You want to do that before you do any other work with a recipient. So just 1 point, 2 point. And that is the key that unlocks the body. It begins and really sets up a harmony between you as the associate and the person who's going to be receiving BioTouch as the recipient.
If you're doing it on yourself, do you still do this?
Well, that's a really good question, because BioTouch, the description is one person touching another person lightly on the skin. So BioTouch is taught as a relationship of healing, one person touching another. Now we have this question every time, so is it going to be harmful, or is it not going to be effective if you can reach those points and you can do them on themselves? We don't know, and we're saying, can it hurt? No. So just by description, BioTouch is one person touching another. You certainly, if you want to, you can reach those points and you want to do that greeting on yourself, just know that that's not how we describe BioTouch, but you certainly can touch those points if you want to do that. You can't hurt anything. So that's the greeting. Any questions about that? Like I said, very lightly, point 1 on the front, point 2 on the back of the neck.
And that has to be on bare skin, not too close.
We touch on the skin, yes. So sessions at the center or anywhere, women remove their tops, men remove their tops. Women keep their, they can wear a bathing suit top or a halter, bra, whatever. Here's the thing about all of us. We all have a body. Look around. That's the one thing we all share when we visually look at each other. We all have a body. They may look a little different, but we got the same parts. Okay? BioTouch, that's the magic of BioTouch. You touch on the body and then things begin to happen. So we want to touch on the skin. It's a sense. It connects us somehow. Oh, we didn't do the scientific data, but okay.
Well, we'll do that.
We'll do that later. So yes, we want to touch on the skin as much as possible. It's more effective that way. Hey, Kathy. So any questions about greeting? The greeting. You're going to get to practice it. So if something comes up, we can certainly address it then. Okay, so let's turn then to page 20 with the next page. And we're going to do the metabolism. And the metabolism is just a really great set because it helps the body to rid itself of what it doesn't want and to assimilate what it does want. And this could be everything. Anything that's related to helping the body to clear itself out. So we want to use the metabolism. It's a very, very good set to use. So in step 1, we're going to be working on the front of the neck along that large muscle. And we're going to be using what we call matching fire. So we're going to be touching 2 points simultaneously.
I'm looking for a handout.
Oh,
Here. Take
he's
this.
going.
Cool.
Okay. So point 1 and 1, you can follow along in the book, is there's a soft tissue just above the collarbone. It's on either side of that notch right there at the top of the breastbone. You want to rest your 2 fingers right in that, the notch on either side.
Can't quite see your hand.
Do what?
Yeah.
Where is it? You want to hold that 6 to 8 seconds right in that soft tissue. Points 2 and 2 are halfway up the neck in front of that large muscle on the front of the neck. And points 3 and 3 are at the top of the neck in front of that large muscle. And you can repeat any points. If somebody's having some issues, you can repeat the points as many times as you feel you want to. There's no, you don't have to do it just one time. You can definitely touch those points. So that's step 1. In step 2, we're going to be holding. So we call a hold point in our terms a point on the body where you're going to have constant connection with the skin, while the other hand's going to be touching other points on the body. Okay, so for instance, we're going to find our hold point, and it's designated in the book as an X. You see that right on? So there's a line that runs direct. If you visualize a line that runs directly between where the nipples would be on a 10-year-old boy, you want to be on that line, and then about 1 to 1.5 inches to the left of the breastbone. You're going to rest your fingers right there very lightly. And then we're going to be working, holding on the front of the body and working points, touching points on the back. So there is a something that we call the breakover point. It's the where the natural curve of the ribs meet the spine. It's usually pretty definite. We're going to be working around that that point on the back and on these large muscles on either side of the spine. So point 1, we want to be 1 to 2 inches above that breakover point, staying below the shoulder blades, and we want to be holding or touching right on that left spine muscle. Again, 6 to 8 seconds. Point 2 is directly across on the right spine muscle. And point 3 is 2 to 3 inches below and above the hips, below the breakover point on the right spine muscle.
It's hard to see because the tie is in your way. So
Yeah, I know, I should have, let me do this. Okay, so point 1. Point 2 again is on directly across. Point 3 is going to be about 2 to 3 inches, 2 to 3 inches below the breakover point, staying above the hips. And you can repeat those points as many times as you want. That's the metabolism set. It's very easy. So the first step is along that large muscle on the front of the neck, and the second step is on the back. And that is the metabolism. Any questions about that?
yeah, you're talking about the breakover point. I'm not really sure I got
Well,
that.
we usually do that during our
Show it through the groove.
class. Yeah, here, another way to find it is, remember the greeting point in that soft tissue? It's directly through the body
Oh,
from greeting point 1.
for one.
Yeah.
Okay.
Yes,
okay.
that's another way you can find the breakover point.
Okay, and what about?
It's a point of reference.
Okay,
Yeah.
that, okay, and what about 3 and 4 that's a little bit lower? Is that just above your hip bones?
Yeah, you want to stay above the hips and you're working along that large muscle on either side of the spine.
Yeah.
You want to stay above the hips,
Okay.
and
I see
about,
that.
so here, about here would be the breakover. You want to be 2 to 3 inches below that for point 3.
Okay, I see, but if you look at the side where the hip curves out, where the hips are gonna be.
Yeah, you're too low.
Yeah, I see
Sorry.
where you are.
Oh, there you go.
There you
So is that about at the
Okay.
waist?
Okay.
What?
That's about at the waist.
Well, it might depend on somebody's body. It could be. Everybody's body is different. Yeah.
Definitely.
So that's why we use the breakover as a reference point, because you're either 1 to 2 inches above it or 2 to 3 inches below it.
Can you show point 4?
Well, it really doesn't have anything to do with it because it's blood sugar.
Oh, so you don't use 4?
Not for, if you're going to, if you're working with the eyes,
Just 1, 2, and 3.
yeah. That's the metabolism set. 1, 2, and 3 is just the metabolism set. 4 is something you can add for other issues. So tonight we're just working with the metabolism. Okay?
Bring lesson for the eyes.
Oh. Okay, Lester, you gonna come up and let me do the eye set with you?
Oh, boy.
You'll get another.
This is a bonus.
You get a. Okay. Have a seat.
Right.
Okay, is he?
Turn them
Okay,
on-
so we'll-
turn them to the side.
Oh, turn to the side there. Yeah, let me just.
Here, you turn the
Okay.
Oh, all right.
All right. Okay, so the last set is the eye set. And this is going to be the only set that we're actually, remember the whole point is where one hand is having constant contact with the skin while the other hand is touching points. So the eye set is going to be the only set that the whole point and the touch points are on the same side of the body. So you're going to find that whole point. And there is a definite indentation in the skull. It's about 1/3 of the way down from the top of the ear and about 1 to 1.5 inches to the back of the ear. You can definitely feel that in the skull. Another way you can find it is you can put your hands in that indentation at the base of the skull, go straight up the back over that rise in the skull, and you're going to land right into that definite indentation. That's going to be the whole point.
It's okay if you don't do the greeting?
I've already, right, no, you would do it if you were going to be doing this with somebody, but for our purposes, it's fine.
Okay.
Yeah,
Well, she did the greeting.
but not on him.
Oh,
Yeah, but yes, I would definitely do the greeting with him if I was actually going to be doing. So okay.
What do you need?
Yeah, so I just want to, let me hold over here so I can get, okay, so we're holding, and point 1, you can put your head up just like this one. So right in front of the ear where the ear meets the face, you want to be right in front of that.
To the lower.
Well, it's hard for me
I
to
know.
do this
Yeah,
because
right.
he's, where am I?
Stand behind him there.
Then I need to do it the way I was. Because then I can get to both sides.
All right.
Okay.
Well, that way they can
All
see my
right.
eye closed.
There we go.
All right.
He's
Okay,
got to
so-
turn, he's got to
This
turn,
is-
he's got to turn his head.
Okay.
Yeah,
no,
there you go.
So
whatever.
the hold is
So
your
the
right
ho-
hand, where you hold?
No,
you sit
it's-
down, it
No,
doesn't
you're
matter.
done.
You only do that with the
With the
greeting.
okay.
Yeah, everything else is,
left
you're
hand
using
is-
both hands. So you would use your left hand to do the greeting.
It doesn't matter.
Right,
Okay,
right.
gotcha.
Okay, so where the ear meets the face, point 1. It's almost, if you look in the book, the whole point is almost in a straight line with the other points. Okay, point 1. Point 2 is halfway between point 1 and the outside corner of the eye.
So the temple.
Point 3 is at the outside corner of the eye. And then point 4 is on the closed eyelids. So you always want to make sure that they can touch very lightly, right on the eyelid. That's it. And you can touch those points as many times as you want, and then you repeat on the other side. So you're going to find your whole point, which is 1/3 of the way down on the ear, about 1 to 1.5 inches to the back.
Excuse me.
Mr. over here is.
Yeah, no, he's
Yeah.
right.
Well, we gotta see it.
So,
Can you see now?
yeah.
So if you find-
Okay, so again, point 1 is where the ear meets the face. Okay, right in front of the ear. Point 2 is halfway between the outside corner of the eye and point 1. Point 3 is at the outside corner of the eye. And point 4 again on the closed eyelid. Where is it? Right here.
It's the part that's closed.
Yeah, right. It's closed. And that's the eye set. And again, you can repeat those points as many
Can I
times as
ask
you
you a quick
want.
question? One of the things he said was, so your right eye has actually opened up more.
That's what we think.
Well, I mean, it was evident, because it's evident to me, obviously.
Is that right?
Oh, yes, definitely.
because-
Your
well,
lid is not as droopy, and that's what you were talking about, the
And
droopy
if you
lid.
remember, she said something about earlier on, you can always do extra work before go repeat
Right.
and repeat and repeat. Well, that's what she's been doing on
So,
this
indeed,
side. And
so-
some sweeps and so
Do
on.
I know that that's
No,
doing
but I
it?
mean,
No.
when you looked in the mirror, you could tell the difference too, because it's obvious.
I had to look, yeah, somebody did tell me.
No, it's
Yeah,
obvious to me.
and then Beth said, you know, yeah.
Okay. that's
Thank you,
interesting.
thank you.
Thanks,
So
Les.
Thank you.
that's
Oh,
it.
right.
That's the 3 sets that we're going to,